Thank you, Sam. As you said, we'll now be moving on to the Q&A portion of today's webinar. Many of you have already entered your questions, but if anyone else would like to ask Sam a question, please go ahead and enter it into the Q&A box now. Your first question is from Lisette De La Prida. How often do you need to stimulate to induce reorganization of feedback inhibition? Is only one shot enough?
I don't really know the answer. In earlier experiments, I was trying to play around with this and giving as few as 1 stimulations to as many as 15, but I saw so much variability in how the neurons responded that I decided that I had better fix one aspect of my experiment and let the brain be the variable part. So I know that as few as 3. I can see it, but in the majority of my experiments, I was doing 5 stimulations.
Okay, thank you. Next question, or continuation, plateau potentials are mostly dendritic in origin? Question mark.
Yes, that's right. And I think that this is perhaps a very important difference between my experiments and those that were done with the intracellular current injection, is that I'm engaging feedback inhibition, as was a large topic of my talk. And of course, a lot of this inhibition is going to come back to the dendrites. And so maybe one of the differences between my plasticity induction protocol and that of Jeff McGee and others is that I'm getting massive inhibition that's coming to the dendrites. And so maybe I'm having a limited amount of plateau potentials in my experiments.
Okay.
I don't know is the answer.
Thank you. Next question, do you think you can induce dendritic potentials with optogenetic stimulation?
I think it should be possible. If I were to do it, I would recommend having very sparse labeling of the virus, and I would recommend not having a soma-restricted virus. I did not have a soma-restricted virus. It should be possible. I don't know if I was in my experiments. But I think that I know that I'm recruiting a huge number of interneurons, and you're probably recruiting a lot of feedback inhibition that you're going to be competing with.
Okay. Next question, how many neurons do you stimulate?
Yeah, it's a good question. And frankly, we don't know the answer. And one of the reasons that we don't know the answer has to do with the fact that when you stimulate a pyramidal cell, you indirectly and synaptically stimulate the interneurons, which cause inhibition. And so just because you don't see strong spiking doesn't mean that the light is not actually activating the opsin. There's a classic paper by Shai Shoham talking about the dark matter in the brain. How come we don't record all of the spikes that we would expect to record from our physical modeling of voltage spread in extracellular tissue? We should be able to record 100 neurons per tetrode. How come we only record 10? And so the real answer to how many we are able to stimulate is also being restricted by our ability to record from the activity. So I think that CFOS might get you part of the way there, but that has its own problems. Maybe doing voltage imaging will get you part of the way there, but you'll still have the question of how is feedback inhibition preventing your ability to see the optogenetic drive. And so I would say that we're stimulating more than 10, but less than 100. That's the best answer I've got.
Okay, thank you. Next question. Are you planning to use new low artifact MicroLED probes, which supposedly have stimulation artifact less than 50 microvolts peak to peak in your upcoming research on epilepsy? How might this help seizure forecasting emulation specifically?
Yeah, this is a great question. And I was just talking to some of the team at Plexon about this. These devices hopefully will be commercially available soon. And I could see this being extremely valuable because what you can do is you can stimulate and record at the same time, which you can't do, or maybe it's just, you can, but it's very technologically difficult to do with electrical stimulation. So yes, absolutely. I can see some value at this. I think that maybe future probe designs that have a larger anatomical spread of where the lights are would be particularly helpful because here we're stimulating in a rather small volume in the brain.
Okay. Do you think that stimulation during sharp wave ripples strengthens the underlying excitatory and inhibitory connections in a similar way? Would you think this would be why interrupting SWRs leads to less place cell stability?
Sure, I love that hypothesis. I don't know if people have done the experiment where you stimulate during the ripple and show subsequent plasticity of the place fields. Maybe that's in Antonio Fernandez Ruiz's paper, I don't remember. For sure they silence. And I love this hypothesis that maybe when you silence, you're disrupting the normal kind of coupling that you would expect during the ripple, which is important for the place field plasticity. And I should also say that one of the cells that is most reliably firing during the ripple is the interneuron. And so if you want to have an important fire together, wire together model, then between the pyramidal cells of the interneurons could be during the ripples is a prime moment to have that.
Next question, do you think that it is possible to stimulate LFP as well?
What is that? I don't know, understand, stimulate LFP.
I'm not sure if the attendee who posited that question could clarify. We can come back.
When I stimulate, if I use enough power, you can induce an artificial high frequency oscillation that you can see in the LFP. And I deliberately tried to titrate my stimulation so that when the animal was in the Hope cage, I just barely got a high frequency oscillation. When the animal is running in a theta state, you can see that the overall inhibitory tone is higher. And so an equivalent amount of stimulation never induces that kind of oscillation. And so I think that it's known from several lines of work that the threshold to spike is higher during the theta, during the non-theta state. But in terms of, the question is whether you can induce changes in the local field potential with these micro-LED stimulation, the answer is yes. And there's publications from Yuri's lab by Aaron Stark with specifically studying that.
Okay. Next question. What do you think is the source of the fluctuations in neuron pair coupling, parentheses, independent of stimulation?
Yeah, I think that one of the cases could be that you're getting a presynaptic modulation of the presynaptic terminal. One of the cases could be that you're getting changes in the coupling from the spine to the dendrite. One of the cases could be changes from the dendrite to the soma. And I think that all of these could be modulated by the activity that's ongoing within the local network. And I think that all of these could be modulated by different kinds of neuromodulators, for example, acetylcholine. And so certainly one of the big factors, which is changing which of the sets of synapses seem to be high and low, is sleep and wake. And so it could be a number of different kind of neuromodulatory effects. I should say, and I didn't put this slide here, that the synapses that are rising and falling together, you could have one postsynaptic cell with one synapse that goes high and one that goes low, and the same with the different presynaptic cells. And so it does look like the synapses can operate independent, not independent, but differently than the soma itself.
Thank you. How are micro-LEDs driven? Do you use a function generator or a current source? What is the best choice?
Yeah, I was having this conversation with some of the people over at Plexon. I've had this conversation with Mishi and Yusik a number of times before too. I've always driven in voltage mode. I use the CED voltage generator, and what I do is I keep my voltage set to just below the forward driving voltage of the LED. And if you give non-square pulses, and you're just below the driving voltage, then you can minimize the artifact. The new generation of these micro-LEDs should have very, very small artifacts, and there I would strongly recommend going in current mode because of the reasons that Mishi described in his talk, with the linear relationship between the amount of current you give and the amount of light output. Let the brain handle the nonlinearities rather than your experimental prep.
Okay. Next question. How reliably can you drive a neuron from trial to trial?
Yeah, so this, I think we can be lulled into the sense that we have the ultimate control with our experiments, that we turn on the light, then the brain is going to obey exactly what we do. But of course, if you look to see what's the firing rate of a neuron that's being driven by the light and correlate that with the firing rate for the spontaneous events, you see a very strong relationship, a strong correlation. I embedded within one of the plots that I showed previously is that the pairs of cells that have a strong synaptic coupling between the pyramidal cell and the interneuron during the spontaneous case also are strong stimulated as well. And so our stimulations are engaging natural circuits. And so after the first several couple of milliseconds, you have all of the different recurrent inhibition that's coming in. You're also stimulating, the effect of your stimulation is likely contingent on what's going on in the brain at the time of the stimulation. I think that everyone who stimulated the brain can see, for example, these differences in threshold when the animal is moving versus when the animal is still. And so you can see quite a lot of variability from trial to trial, and that variability is not random. That variability is going to be depending on what the animal is doing. That's my answer.
Okay, thank you. Next question. How long can you leave the implant in place with stable recordings? Does the recording quality change over time?
I have recorded successfully for over 4 months. I have seen that with repetitive, and by repetitive I mean thousands and maybe over 10,000 stimulations, that you can, something might change with the micro-LED so that the subsequent stimulation seems to leak current and affect the recording quality. But I have left the probe in place for months with stable recordings, and in some cases I've done thousands of stimulations, and the MicroLEDs have worked as well.
Thank you. What causes the drift in place field representation in the control condition?
Nobody knows. I think that could have to do with fluctuations in phosphorylated Krebs. It could have to do with patterns of inhibitory coupling, like I showed you. I think that this is an important question for the field to answer.
Okay, I think we have time for one last question. How do you know if Crossshank drive is synaptic or light spread?
For me, the best evidence came from my cross-region comparison between CA1 versus CA3 in the dentate gyrus, because I did exactly the same stimulation protocol, but in CA3 in the dentate gyrus, I always observed Crossshank drive, but in CA1, I didn't. And so I think that in general, it's tough if you're stimulating an excitatory cell and you see spikes in any of the cells that you're recording, you cannot differentiate because of timing if it's synaptic or if it's direct optogenetic drive. The synapse is operating too fast and the charge time from the opsin is too variable, at least if you're recording in these same areas. But the fact that I observed spatially restricted drive in CA1 and not in CA3 leads me to believe that my light is not strong enough to be inducing Crossshank drive in these experiments.
Okay, thank you, Sam, and thank you to everyone who attended. This is going to conclude our webinar for today. If you have any questions about purchasing the NeuroLight optoelectrodes, please contact Plexon at info@plexon.com or go to plexon.com for more information. Thank you.